Hello, I'm Dr. Karri Cardinal of Cardinal Chiropractic and Cardinal Weight Loss. And today we're going to talk a little bit about the ideal protein weight loss protocol. So, our bodies are actually designed to gain weight. If you look at this ancestrally, we are designed to eat. We are literally wired to eat. And that's because we didn't know when our next meal was coming from. So, we ate as much as we could when we could. Unfortunately, in this day and age, this doesn't work for us. The North American diet isn't making it any easier for us. There are tons of foods that are readily available 24 hours a day, 7 days a week, and they are loaded with preservatives, calories, and sugar. And this is why we have an epidemic of obesity, especially in the United States. 2 out of every 3 American adults is overweight, and 1 in 3 US children are overweight or obese. The current generation is expected to actually live less than their parents. This is the first time in 50 years that we actually lowered the lifespan. And $147 billion is spent every year by the healthcare industry on obesity-related health issues. And when it all comes down to is, unfortunately, sugar. Now, we actually have 3 different types of macros or 3 different types of food groups. And it is important to eat all of our food groups. They are carbs, protein, and fat. However, carbs are the easiest to overeat, and that's because they're not very satiating, meaning they're not very filling, and they're also very cheap, very easy, and they taste good. But unfortunately, every carbohydrate that we eat gets broken down into sugar when we digest it. That's any carbohydrate. So yes, fruits and vegetables, they are carbs, and they also will get broken down into sugar when we digest it. Now, are you going to gain weight from overeating fruits and vegetables? Probably not. But sometimes the foods that we eat, while they might not make us gain weight, they can prevent us from losing weight. Now, what happens to your body when you eat more carbs or more sugar than you can burn off? Where does that extra sugar go? Well, unfortunately, it goes right into your fat cells. So your body produces a hormone called insulin. Insulin's primary job is it's a blood sugar reducer. So that means that it's going to take the extra sugar out of your blood and it's going to lock it right into your fat cell. So in fact, your fat cells never go away. They just get bigger as we gain weight and then they get smaller as we lose weight. But they are always there and they are always ready to do their job. Now, unfortunately, we have a metabolic disorder epidemic in the United States, and that metabolic disorder is called Syndrome X. Syndrome X is associated with 4 symptoms. They are abdominal obesity, high blood pressure, high cholesterol, and high blood sugar. But you only need 2 out of these 4 symptoms to be clinically diagnosed with Syndrome X. So if you have any 2 of these, that means that your body is actually on its way to being diabetic or pre-diabetic. You are over-carb consuming, you are constantly overproducing on insulin, and your body is starting to break down. Now, the only real way to cure a metabolic disorder is by changing the way you eat. Simply masking these symptoms with medication isn't curing anything. As soon as you stop the medication, these levels are going to rise right back up. So if you want to get rid of a metabolic disorder, you have to change the way you eat. Now, the way your body works is you have 3 fuel sources of energy. You can get energy from sugar, you can get energy from protein, or you can get energy from fat. However, sugar is your body's primary fuel source of energy. So that means it's going to burn that first. It doesn't matter how much fat you have available for usage. If you are giving your body any sugar, it will burn that. And this is why, like I said previously, there are foods that, yes, might not make us gain weight. Again, keep in mind high starchy vegetables and fruit, but they can prevent us from losing weight, okay? That's because they have a higher amount of sugar in them. So if we're eating that sugar, we're going to be burning that before we burn our fat. In order for your body to get into fat metabolism, which we call ketosis, you actually have to exhaust your sugar stores. In fact, research shows us that the average person needs to eat under 50 net carbs per day in order to get into ketosis. But here's also what happens. Once your body's in ketosis, once you're starting to burn your extra fat stores, your body also wants to burn protein at the same rate. So what in your body is made up of protein? Lean mass. We never want to use our lean mass as an energy source. That is not healthy. Your lean mass is basically your metabolism. If you're burning through your lean mass, you are tanking your metabolism, and that's going to make weight loss even harder. So we actually have to spare your muscle. And how do we do that? We spare your muscle by making sure that you're eating adequate amount of protein. This is why we call this the ideal protein diet, because we're giving you the ideal amount of protein that your body needs. The average person should be eating 0.5 gram of protein per ideal body weight in pounds. So that means if your ideal body weight is 140 pounds, then you should be eating about 70 grams of protein per day to maintain that. And honestly, this is regardless if you're dieting or not. And then if you're working out pretty aggressively, you need to be even eating more. Some people, with the way they work out, are like at a 1-to-1 ratio. Now, there's a lot of mistakes that people make when they go on a diet on their own. One of the most common mistakes that people make is they're just going to go on a balanced diet. And a balanced diet is good because it's going to keep you balanced. You're not going to gain weight, but you're probably not going to lose weight either. So a balanced diet is more for someone who is in stabilization or maintenance. The other mistake that people make is they go on a hypocaloric diet, or they just eat less, portion control. Unfortunately, this doesn't work either. And that's because no 2 calories are created equal. There are certain foods when we eat them that are going to stimulate that insulin production. Now remember, insulin is a fat storing hormone. So if you're eating foods that are stimulating insulin production, you're not going to be in weight loss. So in order to be an effective weight loss, yes, you have to reduce your calories, but you have to reduce them the right way. So with ideal protein, we go on a temporary unbalanced diet. And so what we want to do is reduce your carbs. We want to reduce your carbs way back. Again, we need to get under 50 net carbs in order for you to go into fat metabolism or ketosis. And then we're also going to reduce your fat somewhat because we want to get those calories low. We do want to make sure you're getting your essential fats because they are important, but we're not going to be overeating on fats. We're not going to be eating a pound of butter or a pound of bacon a day. Unfortunately, that doesn't work for weight loss. But most importantly, what we're going to do is make sure that you're eating your adequate amount of protein, the amount of protein that your body needs to make sure that we're sparing your muscle. This is one of the reasons why we call Ideal Protein a fat-burning, muscle-sparing weight loss program. Ideal Protein is broken down into 3 different phases. During phase 1, which is the weight loss phase, you are eating 3 ideal protein foods per day. You'll have 1 for breakfast, 1 for lunch, and 1 for an after-dinner snack. You will also require to eat plenty of vegetables, minimum of 4 cups per day. And we go over in detail what vegetables are good, which have the lower amounts of sugar, and which ones to stay away from. And then your dinner protein is actually on your own. And you can have chicken or fish or pork or beef or even eggs, whatever you like. And we also allow people to have vegetarian proteins as well. Once you've met your weight loss goal, we move you into our stabilization phase. Our stabilization phase, is where we're going to adjust the macronutrients to the right proportions for you. Now, everybody is different. We have some men, we have some women, we have different ages, we have different hormone levels, we have different gut biomes, we have different genetics. So everybody's macronutrient intake is going to be different. But we do go over with each individual how many carbs you should be eating a day, how much protein you should be eating a day, and how much fat you should be eating a day in order to make sure that you're not only satiated, meaning that you feel full, but that you're also maintaining your weight. During this phase, you're going to eat anywhere between 1 to 2 ideal protein meals per day. Again, you're going to be getting those plenty of vegetables, minimum of 4 cups. And this is when we reintroduce the healthy fats and carbohydrates back into your diet. During this phase, your lunch protein and your dinner protein is on your own. This phase typically takes the average person 4 to 8 weeks, depending on how much stabilization needs to be done. Once we've determined that you are stabilizing your weight, then we can move you into our maintenance protocol. During our maintenance protocol, you're eating all of your own whole foods. Some of our patients choose to continue using the Ideal Protein products as snacks throughout the day, and that's fine. But your main meals, meaning breakfast, lunch, and dinner, should be all on your own using whole, hopefully organic foods. Everybody's different as far as how much maintenance they need, but we do recommend that people maintain with us for at least a year after they've met their weight loss goal. The first year of weight loss is the hardest because your body does want to go back and your brain wants to go back to those old bad habits. So we really want to make sure that you're getting it down. The whole important part of Ideal Protein is not weight loss, believe it or not. The most important part of this program is it's a lifestyle change and that you're literally learning to eat healthy for a lifetime. All of our foods are USDA approved. There's also no GMO, aspartame in any of the foods, and we have over 80 delicious foods to choose from. And believe it or not, each of our products has about 15 to 20 grams of highly bioavailable protein in them. Some of the benefits of just 5 to 10% of weight loss, which can happen for most of us in just about 4 weeks, is we can see improvements in blood pressure, blood cholesterol, and blood sugars. We can also see increase in energy levels, mobility, mood, and self-confidence. This is Dr. Karri Cardinal of Cardinal Weight Loss and Cardinal Chiropractic, helping you to look and feel your best.